Hello everyone, my name is Andrea Service, and today I'll be presenting about my quality improvement capstone project in a postpartum unit, which is improving the use of teach-back method during postpartum discharge education. In my hospital's postpartum unit, postpartum patients are often discharged within 26 hours after vaginal birth and 36 to 48 hours after CS birth, requiring nurses to provide large amount of discharge education in a limited amount of time. Due to this high patient turnover, nurses have reduced opportunities to confirm patient understanding of essential maternal and newborn discharge information, such as warning signs and follow-up needs. The current discharge education used in my unit is information giving instead of understanding verification, with nurses frequently documenting that discharge education was introduced or reviewed instead of patient demonstrated understanding. This is significant since it is estimated that 80% of patients forget what the healthcare provider verbally tells them immediately. Although teachback is evidence based, it is not consistently incorporated by nurses during postpartum discharge education. Without confirming patient understanding, patient may have decreased understanding, which may contribute to preventable complications and readmission. So, teachback is an evidence based communication strategy where nurses ask patients to explain health information in their own words to confirm their understanding. It does not test the patient, but it is a way to test how well the nurse explained the information and identify the need for clarification. Its benefits include safer transition of care from home to hospital. It closes the gap between patient and provider communication, improves patient understanding, self management, and health outcomes, and reduced readmission. There are also numerous studies findings that support the benefit of the use of teachback method in postpartum population. For example, Chang et al. Study demonstrated that teachback significantly improved maternal health literacy, with 50% achieving adequate literacy compared to 8.5% with standard education. Mustafanazid et al. Study also found that teachback improved maternal discharge readiness score with 43.12% compared to 36.6 and fewer outpatient visits after NICU discharge. Additional studies also showed improved breastfeeding success, medication knowledge, and improved patient satisfaction, which this is evidence that support benefits of consistent use of teachback to postpartum discharge education. Evidence also supports teachback implementation as a quality improvement intervention. In Martinez's quality improvement study, her teachback intervention included education and bedside coaching and observation feedback, which increased nurses' feedback use from 21% to 82%. It also increased their documentation to 61% and patient experience to 97%. Brand's study also found that re-education training and quick reference guide increased teachback use from 83% to 100%, improved documentation to 70%, and increased nurse confidence to 76%. These quality improvement interventions shows that education, standardized tools, and ongoing reinforcement can successfully increase nurses' teachback use and confidence, supporting the feasibility of implementing teachback in postpartum discharge education. So the aim of my quality improvement project is to improve the nurses' consistent use of teachback method during postpartum discharge education. The objectives are to increase nurses' confidence and consistent use of teachback and improves patient experience of discharge teaching. The settings will be conducted in a postpartum unit, and the participants will include postpartum registered nurses providing discharge education, postpartum patients receiving discharge education, and quality improvement observers or leaders who will be responsible for education delivery and data collection. This will be implemented over a 10-week period. So my intervention will include in week 1, the quality improvement team and project observers will complete teachback training using resources from Institute for Healthcare Advancement and the Agency for Healthcare Research and Quality. This ensures that observers have the knowledge needed to support and evaluate consistent teachback. In week 2 and 3, baseline data will be collected where nurses will complete the conviction, consistency, and confidence self-assessment to evaluate their current confidence and use of teachback. Observers will also use the teachback observation tool to assess current application of technique, and patient will also complete a quality of discharge teaching scale to measure their experience of discharge education. Moving on, in weeks 4 and 5, the nurses will receive a brief 10-minute teach back education session during daily safety huddles. The education will include the importance of teach back, the 10 elements of competence for using teach back effectively, and practical strategies from IHA and AHRQ resources like staff handouts and visual reminders placed at nursing station, which provide ongoing reinforcement. In weeks 6 to 8, nurses will apply teach back during routine postpartum discharge education. Then the observers will evaluate implementation using teach back observation tool and provide feedback to support improvement. On weeks 9 and 10, postpartum intervention data will be collected, such as pre and post intervention nurses' self assessment scores and patient quality of discharge teaching scale scores will be compared to evaluate changes in nursing practice and patient discharge experience. So, for nurses, the intervention is expected to increase their confidence and consistency in using teachback as part of postpartum discharge education and may also strengthen their communication skills and increase their adherence to evidence based patient education practices. So, for patients, the expected outcomes also include improved understanding of essential postpartum newborn discharge instruction, increase in managing their own care and caring for their newborn, and a more positive discharge teaching experience, which is reflected through their higher score of quality discharge teaching scale. So the consistent use also support safer transition from hospital to home by ensuring mothers understand discharge information. So this project has numerous strengths like leadership support, evidence-based and validated low-cost resources that can be easily integrated into postpartum discharge workflow with minimal resources. Its potential limitations include limited discharge time, high patient turnover, competing nurse workload priorities, survey response bias, and short evaluation period, which may limit assessment of long-term sustainability. These barriers, however, can be addressed through brief staff education, leadership support, ongoing feedback, and reinforcement during practice. Also, since it's a communication framework, it can be generalized to other healthcare settings like inpatient, outpatient, and transition points to improve patient education and discharge communication. So, my project has many implications. So, for nurses, it includes improving their communication skills and confidence in discharge teaching, promotes active verification of patients' understanding, and it supports a consistent use of evidence based education practice. Also, for postpartum patients, it improves their maternal newborn health literacy by ensuring they understand warning signs, newborn care, and follow up needs before going home, which promotes safer management and helps reduce preventable complications. For healthcare system, it reduces healthcare system costs as teachback is a low cost discharge approach, and since it improves patient self care and understanding, it may also decrease readmission and its associated costs. Also, it advances nurses' role as leaders in implementing quality improvement initiatives that improves patients' outcomes. So, my recommendation to support this quality improvement include integrating standardized teachback tools into postpartum discharge workflow and teachback education into nurse orientation and annual competencies. Also, we want to monitor its effectiveness through staff feedback and patient experience, such as using tools like patient QTDS and nurse self-assessment surveys mentioned earlier, and expand it to other units and transition care settings. Since due to its low cost and adaptability, it can be sustained and implemented across diverse healthcare settings. I've come to the end of my presentation. Thank you so much for listening. Here are my references.